Hello, I'm Timothy Park. I am the Director of Spiritual Health at Emory Johns Creek Hospital. It is my pleasure to welcome all of you who are watching this wonderful video today. Today we are going to be covering a very sacred topic, that is spirituality during end-of-life care, part 2. There is a part 1 available on YouTube. I hope you get to watch that as well. Thank you for watching.
My name is Manhalal Valand, and I represent the Hindu faith, and as a Hindu chaplain, I work with the Emory Hospital University System and other hospitals, and I provide them with the information for the terminally ill and the caregivers. Hinduism, the process of death and dying, considered a good question, is for those who are terminally ill. It's easy to understand because life and death is a natural situation for everybody. And in most instances, particularly with the Hindu perspective, that you will come back, reincarnation is the central tenet of it. So many times people do not worry that sooner or later they have to release from this body. And of course the soul departs, as we all say. So it's a natural process. Especially from a Hindu perspective, when they say in death and dying perspective, that if you do not need to resuscitate, it's almost like an accepted fact or phenomenon that they do not want to live any longer because it's a given, especially in terminally ill patient, for somebody who's terminally ill, such as a cancer patient. As far as intubation is concerned, they do not want to be intubated, they do not want to be, of course, resuscitated. So all these DNRs and all the other various codes that's used in hospital, patients are aware of it, and caregivers know exactly what is required and what is not required for that particular patient if the advance directive is already given. For a Hindu patient, end of life, if pain is involved, naturally pain, particularly in the terminally ill, then anything that will help them to relieve that pain is helpful. Hindus fortunately go through the yoga, which is a system where their mind and body is connected to the point where they may be able to reduce and relieve that pain without medication, which is also a nice way to do it because directly or indirectly they're coherent without the medication. And it makes absolute sense that if the doctor or the caregiver is working with the patient, and that may be helpful. Sometimes even the prayer beads might help because a lot of times people do prayers, and these prayer beads certainly provide them that relief, and that certainly is helpful too. Many times, if the caregiver has some idea of the Hindu Gita, which is like the Bible, then they can use certain slokas, phrases, from that Hindu our Gita, and that naturally is helpful for the patient, which is what is to be done, what is not to be done. Some of them are vegetarians, obviously they do not use meat as a final meal or a source, even though they may want that. Many times they just want to go the non-meat source, vegetarian source, because it gets you to the higher planes and the elevation. So your consciousness becomes more aware, and when you're conscious of your death, it's so much easier to make that final journey, sacred journey. Yama in Niyama, these are do's and don'ts, which is also part of Bhagavad Gita. And many times when Bhagavad Gita is written in Sanskrit, not many people know of it, but English versions are available, which will be here in the chapel. And last but not least, many times some of them obviously will do their sound songs and what we call singing, which is for their prayers, which also helps them. Every Hindu believes that this is not my last life. Hopefully, if it's a last life, even better, because then you've reached that knowledge portion where you don't have to come back because you're completely full with joy and peace, and this is hopefully your last life, so you don't have to come back. We hope that most people understand that's part of the Hindu faith, the oldest faith, and it's all connected with the Buddhism, Sikhism, and many others, Jainism, etc.
My name is Geshe Pente, and I'm from Drepung Loseling Monastery in Atlanta. From the Buddhist perspective, the dying is what you call the preparations of our new life or the next life. The reason is Buddhists believe our mental continuum or our spirits never age. It goes continuously. So when we talk about the death, which means we are changing our physical, the body, and transforming or changing into the new body. So this is like very exciting to looking something new, rebirths or new births. So that's how the Buddhists see. In general, Buddhist, we do not have any sort of like a decision, whatever, this is completely individual, whatever they wanted. From the Buddhist perspective, we have not any something rule, you should follow this or that. But the main point is we are very seeking, like, important is to keeping the dying person's mind should be very calm and positive. So whatever we're doing, it's helping for the dying person, keeping their mind is calm and positive. That's the main point. So attachments and attached to anything, attached to even like a simple, like a material things can causes from the Buddhist patient, that can causes them for fear of death, and it can causes for suffering. So it doesn't matter it's the objects are important or not. Even like a simple, small, nothing that much important things, but attachment, the mind can see different way. As long as when you have attached to these things, that will causes them the problems during the day. They have many different methods to release the distress of the patients. One of the important I mentioned earlier, one of the main fear and stress when the patients are dying is caused by attachment. So we always teaching them to deal with the attachments. That's the one very important thing. So these kind of things that we have to talk before, to deal with these things. For the urgent, when the people are dying, so our focus is to keep the patient's mind very positive and virtuous. So in order to keep the virtuous, positive mind, we sometimes use some special prayers, or we sometimes use the showing your faith, the image of your faith, which is Buddha or anything, your gurus, your teachers. So something encourages, something helping her, that somebody can save me, or something makes her mind, his or her mind calm. So sometimes, even this is difficult, then one of the, what you call the important, the message we explain them is, we try to remind them, so when they are alive in the past time, when they did something good to the society, any good job that they done, we're reminding them to their good job, to rejoice what they done. So that rejoicing helps them to keep their mind calm and happy. So that's the one main we're doing. One important thing is Buddhist believe our reincarnation, the rebirth, so everything we're doing in this life is for next life should be a much better life. That's all the Buddhists believe. So next life's better life is very important in the last minute of this life's mind. So as caretakers, we always, encouraging the Buddhist patient how should keep their mind calm and virtuous. That's the more emphasizing. So, anything we're using like painkiller or whatever medicine, it's, if they're benefiting the patients, the mind's very calm. For instance, some they have too much pain, then they can't keep their minds calm because the pain can create them anger and hatred. That's not good. So in order to keep their minds calm, sometimes we use the painkillers and all. So the point is, whatever we're doing, it's something helping to the patient's mind to really concentrate and living with a very peaceful and virtuous mind is our main point or our focus. That will so much effect to their next life, much better life.
My full name is Gulberg Singh Basi, and I'm representing Sikh community in Atlanta. Sikhi perceives dying process as part of the journey on this earth, and it is natural. Every being that is born is going to die someday according to their lifespan, and hence it is just a part of life. It's nothing unexpected. When they get sick or something unexpected happens, they expect, they would like to come back and get rid of whatever is ailing them. However, in cases where we are looking at in the end-of-life cases, they would accept. Sikh philosophy is to accept the will of the God, however it happens, and they will accept. If it is a terminal illness, so be it. As far as Sikh is concerned, it is normal. Whatever help is available, they'll accept it. However, when it's a terminal case and nothing can be done, they'll accept that as well. It is the acceptance of the will of the Creator that matters. What might cause spiritual stress at end-of-life cases, I cannot think of anything as per Sikhi. However, we are all human, and yes, some people might be spiritually stressed, and then mostly the cure for that kind of thing is the presence of family members, or if there are no family members, listening to or reading the message from the scriptures. Again, I'm not aware of anything in Sikhi that will cause a spiritual stress, because the process or the belief in Sikhi is everything is under the control of the Creator, and we accept the will of the Creator happily. Therefore, there is no Sikhi way of being stressed at the end of life. However, we are all human, and some people, different personalities, might be stressed, and the way to relieve that stress is to let them read from the scripture, or just play some hymns from the scripture that are available on YouTube, and that'll be just about the best thing. In order to make their experience better, hospital staff, I think the best they can do is keep the person in the comfortable place. If they are initiator 6, make sure they have their full dress, and just make sure that they have availability of the scripture, either in written form, small booklet, or they can listen to on the YouTube videos. And that's about all that we can do, other than in addition to normal patient care. What's most important is, at the time of the outward body, is their hair. Please do not touch them. And their articles of faith, if they have them on, leave them on untouched. That is the care that one must know about. It is practiced, no intoxicants, no tobacco, no alcohol, unless of course it's part of the medicine they are being given, they're being administered. So that's what one needs to be careful about.